So it's a privilege to be with you to celebrate this evening. We're honored to have so many friends and supporters with us today. I especially want to welcome our new inductees and their families, friends, and colleagues who are with us to celebrate their exceptional accomplishments and to thank their nominators for putting them forward for this honor. Additionally, it is a privilege to have a number of our previous inductees return each year.
The state of Florida has always attracted the explorers among us, and those individuals who are driven by curiosity and wonder, those who see things differently. It is this spirit of invention that makes our state such a unique environment of diverse ideas and perspectives. It is this spirit of invention that inspired the creation of the Florida Inventors Hall of Fame, which now includes 35 historically significant inventors with ties to Florida. The 7 new Hall of Fame inductees we will honor this evening have made their own significant contributions to our society, representing a broad range of disciplines, everything from aeronautics to regenerative medicine to apparel.
It is my privilege to be here tonight to honor 7 extraordinary inventors who are a significant part of our inventive history. These inventors have jointly contributed, as you heard, a remarkable 189 patents towards this milestone of 10 million. American innovation is alive and well and thriving.
Our first inductee tonight is Sarah Blakely. She is the inventor of the renowned undergarment Spanx. Here's a video of Sarah Blakely.
What are Oprah's favorite things this year?
So fabulous. Everybody's butt looks just like this. It's amazing. I love it so.
My next favorite thing is a great invention, a result of one woman's determination to make her dream come true. Take a look at this.
Have you ever had a good idea but were afraid that maybe it wouldn't work out? Well, you're about to meet a woman from Atlanta who took her idea to the drawing table and made it happen. And now women all over are saying,
genius invention.
Genius invention.
Share.
Yeah.
So you're sitting there, just like we do every day, waiting for a sign. Something else I'm still waiting for. A sign to tell you what to do with your life. And while you're sitting there, you're futzing with your pantyhose. And then it dawns on you. That is the sign. And the next thing you know, you're jumping up and yelling, "Spanx me."
What line of women's undergarments features the cheeky tagline, "Don't worry, we've got your butt covered"?
They're called Spanx.
You gotta love the Spanx. Yeah, right.
What do you wear under something like this? Spanx. Love it. If you keep the Spanx on, it'll all work out.
She's got better Spanx
Than I do.
Hold on to your Spanx.
And you're smiling your Spanx, baby, and you're ready to go.
If you don't know what a Spanx is a girdle that everybody wears, evidently.
There's some serious Spanx going on.
And it squeezes all the fat in and the skin. If you want money or good china, you can hide that in there.
you need baby Spanx. The super elastic shapewear that smooths out all of your baby's unsightly bumps and bulges. In no time, your baby will go from flab to fab. Guys are wearing Spanx right now, which I think is actually genius.
I happen to have one of the best bodies here.
You do?
Yeah, I do. He's wearing Spanx.
I'll buy you a panini and some Spanx to make you teeny.
And for making women feel great, Sarah then competed on a reality show.
Sarah Blakely. She grew her invention Spanx into a global fashion force.
You get a huge yes from me, so you go, girl.
Thank you. Forbes is out with its annual list of billionaires, and a new addition to the list really stood out. The 41-year-old who acquired her assets by making all of ours look better.
For that, you should be worth at least $1 trillion in a lot of women's opinions. What are Spanx?
Spanx, yes.
Don't underestimate a woman who does not like the way her butt looks in white pants. I mean, what do you want me to say? I never. That's the soundbite of the day, honey.
She's the reason you have to be bullish on America. She was thinking about what can you do to make in this case, women's lives better. Now she's got them for men here.
Well,
Who knows what's going to happen now?
They say that I have been making the world a better place one butt at a time, and now I'm determined to make the world a better place one woman at a time.
And this surge in generosity is not by accident. Much of it is the result of an ambitious and targeted campaign called the Giving Pledge. Membership comes with just 2 requirements. Be worth at least $1 billion and be willing to give half of that away.
I'm proud to say that we are tonight sending 278 girls to college.
We really feel fortunate that we were given a chance.
I don't know what to say, actually. I think the smile just does it all.
She took $5,000 in savings and started the undergarment company Spanx. Now she wants her philanthropy to be as cutting edge as her business.
What I'm most proud of with the success of Spanx is that we've been able to give back to help women more than just their rears. Hi everybody, I'm Sarah Blakely from Spanx, and I just wanted to say a special thank you to the Florida Inventors Hall of Fame for including me in such a great honor. When I saw the list of other honorees, to say that I'm in good company would be an understatement. I mean, reading the list from inventing the flight simulator to advancements in nanomedicine, cataract and eye diseases, and advancements in anesthesiology, and the list goes on. I literally turned to my husband, I said, honey, I make butts look better. In which he then replied, you know what, that's a pretty noble cause. So I'm honored to be included on this list. On behalf of women especially, there's only 8% of primary patent holders are women in this country. So I'm proud to accept this honor. Thank you so much for including me. And my mom is the one accepting it tonight, which is perfect because she's the one who drew the sketch in my original patent. She's an artist and I needed help with that. So she did the drawing that is now in the U.S. Patent and Trademark Office for Spanx. Have a great night, everybody. Thanks again. It's a big honor.
Tonight we celebrate Sarah, the inventor of an astoundingly successful product. Now at this point in time, I won't ask for a show of hands how many of us are wearing them this evening, but I know you're out there. I would suspect that I would agree, I think you would agree, that for many decades to come, we will be celebrating Sarah as a global business leader and a humanitarian. A woman who is empowering others, elevating others, and helping write their success stories as well. We are so thrilled to recognize her accomplishments, and it is my great pleasure to welcome to the stage Sarah's mother, who will accept the Florida Inventors Hall of Fame medal on behalf of her daughter. Please help me in welcoming Ellen Blakely.
Our next inductee is Dr. Emery Brown.
I was born in Florida, in Ocala. I grew up in a small town north of Ocala called Martin, Florida. It's a small rural farming community. I feel like I am a country boy at heart. I'm the youngest of 3 kids. My father, Alberta, Benjamin Brown, were mathematics teachers. That gave us a lot of impetus to study math and science. My mother used to always tell me, she said, you're doing well, but you really haven't been tested. She would, keep my feet on the ground, let's just say, so I wouldn't get too impressed with myself. My mother came in with this brochure. She said, would you like to go to summer school at Exeter? And so I said, yeah, sure, why not? I came to the Northeast when I was probably about 15 or 16 or so, and I've basically been here ever since. I had decided to do medicine, and I decided to do my PhD in statistics. That was a rather avant-garde idea at the time. Data sciences is a big issue now, but if you go back, 40 years, that wasn't necessarily the case. And then during my 3rd year in medical school, I really fell in love with anesthesiology. And I really wasn't trying to think of how I would mesh statistics with anesthesiology. The more I worked on problems in computational neuroscience, developing statistical techniques to analyze the data, I would run into people and they would say, oh, that talk you gave on your methods was interesting, enjoyed it a lot. I hear you're an anesthesiologist, how does anesthesia work? And I go, I have no idea. And, I don't think there are any people who are more mechanistically driven than neuroscientists. And so to be telling neuroscientists, you do something regularly to patients and you have no idea how it works, got to be a little embarrassing after a while. So I thought maybe I should work on this. I realized there were a lot of things that we were learning in our anesthesiology training that were just BS. There were reasons given for things which made no sense. Anesthesiology had developed this whole sort of what I'll call a legal fiction about how to think about what was going on. And people were very, very happy having it be like a black box phenomenon, because if it's a black box phenomenon, you can say anything. No one's pinning you down. And it was even worse than that. It's not that it's unknown. It was perceived as so complex that it was unknowable. And then the more I applied the neuroscience paradigms, wow, I can draw circuits. These are very robust behaviors. Moreover, the signals are very, very strong. Every time we give an anesthetic drug, the brain oscillates. Maybe those oscillations are related to how the drugs are working. My God, that's it. That's what's happening. You give the drugs, they take over the circuits, they drive the circuits to oscillate. You change the drug, you get a different set of oscillations. It all started to come together, not just in a basic science sense, but also in a clinical sense. It jibed perfectly with what I saw in the operating room. The idea that you can do something and then the patients are better off because of what you did, nothing could be better. There's no cooler feeling. And you can walk in the room and say, Mr. So-and-so, I'm going to take very good care of you. You could not be in better hands. We're going to make sure that you're perfectly unconscious during the procedure. You're not going to feel any pain, and we'll wake you up on a dime, and you'll be quite comfortable afterwards. That's the objective. So until you're able to do that with every patient, there's a lot of work to do.
So first of all, I want to thank the selection committee for giving me this enormous honor. It's a tremendous pleasure to be back here in Florida and to have my work acknowledged by my home state. As I said in the video, I'm a country boy at heart. Anesthesia is important. It's an important process in medicine. And as I said, I won't be happy until we make it perfect, so it's perfectly safe for all patients who need it. And in doing so, we also want to use it as a tool to learn more about how the brain works and actually make important contributions to neurology, psychiatry, neurosurgery, and sleep medicine.
Our next inductee is Dr. Philip Furman.
I was probably 8 or 9 years old when I became very interested in science. My uncle gave me his microscope that he had when he was a kid. And it just opened up a whole new world to me and got me very excited about living things and life and made me really interested in science.
I nominated Dr. Furman for an honorary doctorate degree, and he was awarded that last year. And then as I thought about the event I'd been to last year for the Hall of Fame, Inventors Hall of Fame, I realized he would be a perfect candidate for that.
Primary focus has always been, I think, science. Asking questions, getting answers.
Let's see. And I happened to find these here in Florida over in Tarpon Springs. Actually, when I was 12 years old, I saw for the first time an arrowhead, and that got me interested in archaeology in a sense. I mean, I was just 12 years old, but I wanted to find an arrowhead. And I think that was kind of the start of my questioning or desire to discover things. I studied biology, and that's where I developed my interest in microbiology. I took a microbiology course and absolutely fell in love with it. When I was finishing up my master's, and conversations with Dr. Betts, who was a fantastic mentor, I asked him, what should I do next? And he said, the up-and-coming area is animal viruses, and you should consider studying animal virology. And I did. And I decided to go to Duke University to look at retroviruses. Every species pretty much has a retrovirus that causes tumors or something or other. And so I thought, well, why not humans? When the AIDS epidemic started, we were quite interested because we had a feeling that it was a virus that was causing it. So we decided to set up a surrogate virus. We started testing compounds, and AZT was one of the early ones that we selected. It turned out to be one of the most potent compounds I had ever seen against any virus. Just seeing the benefit and being able to do science, good science, and use what I had learned to help humankind out. It was kind of the shove I needed to wake me up to all this and say, yeah, this is what I really, really want to do.
Dr. Furman has contributed so much to the area of antiviral drugs. Almost every antiviral drug that's come on the market that's been successful in the last 20, 30 years he's had a hand in. And it goes from AZT, which is used in AIDS. It goes to acyclovir, which treats herpes. He's also come up with drugs that help with hepatitis B, and most profoundly, and most recently, hepatitis C.
There were so many letters that came in after the drug was approved, thanking the company for developing this and for helping these people out. They were so grateful that I thought, gee, this is really, really neat.
In working in pharmaceuticals, he has always had the people that he was doing these things for in mind.
Being inducted into the Inventors Hall of Fame, the Florida Inventors Hall of Fame, I was just stunned by it. I think it's just a wonderful thing, and I am just so proud to be a part of it, but still shocked that I was nominated and accepted.
I think that a lot of what's driven him is the focus of helping with his colleagues, helping with finding avenues of development, drug development, that would help people.
You know, it truly is amazing what he has done. It's just absolutely blows my mind every time I think about it, that one person could have been involved in all those different drug developments, and millions of people worldwide have benefited from his work.
Thank you very much, and good evening, everybody. When I first received the email from the Florida Inventors Hall of Fame, I didn't open it up. I couldn't imagine what it was all about. I thought it must be an advertisement, so I ignored it. However, before deleting it, I decided to open it up and read it. And upon reading it, as I said in the video, I was shocked. And this was actually for real. I am being inducted. I couldn't believe it.
Our next inductee is Dr. Richard Houghton.
My name is Richard Houghton. I'm the founder and CEO of the Torrey Pines Institute for Molecular Studies. We were founded in 1988, and so now we're 30 years in. Our headquarters and sole site is Port St. Lucie, Florida. In terms of my inventions, I have 84 issued U.S. patents, but the one I'm most known for is my second patent, and that is called the teabag approach. And this came out of a long incubating period in my brain. I was a postdoc and I wanted to cut down the time it took to make peptides. It was very tedious, so in my mind I had thought of a couple of ways to do this, but they weren't practical. And practical is really a very important part of an invention. And the aha moment of my invention of the teabag approach came at lunch. And a colleague of mine got up and said he's going to get some tea with the tea bag. And the word tea bag struck me. So I thought, well, if I can put the resin in a bag, I can have multiple bags, and I can cut 25 steps per addition out of each one of these syntheses. And I can also make 500 or 1,000 peptides at one time with the tea bag approach. So it was a huge advance, recognized worldwide, and very nice. We can now literally screen tens of millions of compounds, but we only have to test 300 to 500 samples. So it's an enormous collapse of the number of things we have to screen and test. So it's a very powerful technique, and it has benefited certainly the state of Florida, and that was one of the reasons we came to the state of Florida. And when we came to Florida, we had a mind to get our libraries into the hands of as many researchers who have an assay within the state of Florida. And we were able to do that with what's called the Florida Drug Discovery Acceleration Program. And we ended up with 51 external principal investigators, so scientists who have an assay, 15 different Florida organizations. We ended up with 10 patent applications that have been filed. Florida has been, in many respects, the example of what we can do. And we're in the process of talking to venture capitalists, et cetera, and making this a worldwide program. The team of people I've gathered together for these projects is really what I'm most proud of. I mean, I'm certainly very pleased about the things I've done, the patents I have and all that, but what I'm proud of is being able to hold a team of individuals who are very intelligent, who are very hardworking, and very collaborative amongst each other. And so it's the team that has really done most of the work. My wife and I have 5 kids, and we try as much as possible to do things with them. My sons, for example, we went on a backpack recently, which was 15 miles in and 15 miles out, and up and down in 6,000, 7,000 feet, 30, 40-pound pack, kind of wore me out. My daughter Lacey, really, we all enjoy music festivals, and we do that every year. It's been really an amazing pleasure, and I can't thank my wife enough for her patience and her participation. She's an integral part of Torrey Pines, and what she's done has been really quite amazing. So I'm a very fortunate guy all across the way. It's a pleasure to be here, and I'm very grateful for this award. and thank you very much. Now, a patent is just an idea until you make it real. And it's the team of people that I'm so proud of. I've worked with a number of individuals at Torrey Pines for 35 years, 20 years, 15 years, 10 years, etc. And it's that team of people that made it happen. And it's a pleasure and a joy to be here. And I want to thank you all. And you made me very proud and very happy. Thank you so much.
The next inductee tonight is the late Edwin Link, former trustee and vice president of the Harbor Branch Oceanographic Institute at Florida Atlantic University in Boca Raton, who invented the flight simulator commercialized in 1929.
Aviator, inventor, industrialist, deep-sea diver. Ed Link did it all. A high school dropout at 17, he would make himself a millionaire before he was 40.
It's hard to explain how important Ed Link was to the world of inventions and the world of science. He was, simply speaking, probably the most prolific inventor we had of the 20th century. He advanced in leaps and bounds how we first explored the sky and then how we explored the sea.
Because of Ed Link, we were able to do things that we couldn't do before. The human family no longer thinks of the ocean as it used to before Ed Link.
Ed envisioned a tool that could simulate the feel and response of an airplane in flight. For more than a year, Ed worked on perfecting his flight trainer, using his brother Theron and others as test subjects. Finally, on April 14, 1929, Ed received a patent for his pilot maker. June 1940, all of Europe is engulfed in war. The German Luftwaffe had begun terror bombing London. And in the skies over England, a tremendous battle raged for control of the air. The Battle of Britain would be the turning point of the air war in Europe. Vastly outnumbered, the Royal Air Force now relied heavily on Link's blue box to train their crews in record time.
Air Marshal Robert Leckie, he was the head of the Royal Canadian Air Force. He said, "The Battle of Britain is being won on the training fields where there are Link trainers."
The small factory that Ed had started 35 years before had grown into a billion-dollar industry and was now the primary simulation resource for training the men who would walk on the moon. But the aviator had moved on to a new frontier and was ready to unveil his latest creation.
The deep diver was the very first working lockout submarine. This was a real stroke of genius. So we would make a dive, let's say to 400, 500 feet, park the submarine on the bottom, and the divers in the back compartment, in the stern compartment, would pressurize and make a lockout dive, going out into the ocean, do their work, come back in, close the hatch, and then come back to the surface.
On January 29, 1971, at the newly created Harbor Branch Oceanographic Institute in Florida, Ed and Seward launched the Johnson Sea Link. Marion described it as the first manned diver-carrying small submersible to be made available to scientific institutions strictly for marine research. He was a high school dropout who had survived the Depression and a world war. Ed felt his life had been touched by magic. "Everything I have," he told a friend, "I owe to my family and to God." In 1953, he and Marion decided to start the Link Foundation.
Ed and Marion, when they set up the Link Foundation, didn't set it up just to give money to people who have 100% grade levels in school. What they set it up to do was to give money to those students who showed an initiative and an energy level that would delve into the science of first the exploration of our skies and secondly the exploration of our seas. He wanted to make sure that those students had the opportunity to develop their own genius.
On May 30th, 1981, with his wife of 50 years by his side, Ed Link received his 5th honorary degree from the State University at Binghamton. After his death, a friend wrote, "Ed Link was a man who saw the sky reflected in water and altered our perception of both. He was a man who touched a spark in the minds of others, a spark that caused a nation to be proud and men to reach beyond themselves to the stars and into the unknown depths of the sea."
Ladies and gentlemen, accepting the medal on Edwin Link's behalf is Dr. Andrew Clark.
Ed Link was more than just an inventor. He was an industrialist, a visionary, and a leader, a brilliant engineer. And despite having dropped out of high school, he left a lasting legacy in our nation's university system and those around the globe.
Well, congratulations. Well, we are now ready to bring up our next inductee, and it is Dr. Sudipta Seal.
Cerium oxide. This is a material that is used in your car converter, which gives you a clean emission, in polishing a microelectronic device. But when you go down to the size with few atoms and few molecules, I can take one atom in the lattice of cerium oxide and put another atom somewhere else, and I can create a new material with a new property. Back in '97 fall, we're trying to deal with nanomaterials. So we made nanocerium oxide to protect steels from degradation. And it's just by a mistake. We find this particular material has got very good antioxidant property, which combats oxidative stress. Oxidative stress is everywhere. By changing the surface structure and the surface chemistry, you can make different types of nanomedicine.
We have been working with Dr. Sudipta Seal for more than 10 years now. We look to the material scientists to develop something that will behave in a way to benefit bone implants, where we see inflammation as a key negative outcome. What we're working on actively now is ways to coat implants so that they have a reduced level of inflammation after they're put into the human body.
It's kind of sky's the limit what this new molecule in nanoscale can do, from glaucoma to cancer therapy to tissue engineering or to diabetic wound healing.
He has been a very productive researcher and carries it all the way through from basic science to patents and working with industry and with partners.
We have invented, I think, something very special. We can take two dissimilar materials and mix them together in ways that have previously been impossible. And using nanotechnology, we've been able to make better performing, higher energy fuels and propellants, but simultaneously have them be safer than what's being used today. My first experience learning how to do this was actually with Dr. Seal as a grad student, developing a technology that ended up being spun off into a company, a startup company. And that opportunity was created for me through Dr. Seal's work in his research at UCF.
We continuously trigger ourselves, either me or my students or my researchers, to think outside of the box, either for space exploration or for medicine or making materials to combat climate change. That is very key to our lab.
He has, at last count, 68 patents awarded. Those patents have been licensed and are being used to produce useful products. Sudipta has won every major award in his discipline, national and international awards. So I call him a classic new American, a person that comes here for an opportunity, in his case, top-tiered scientific education, and he was very successful at it. And he's become an American citizen and contributing in huge ways to our economy, to our education, to the next generation of students and graduates. So I'm very proud of him.
A little bit about myself, growing up in India, in a household with my chemistry professor dad. I said no to chemistry very first time. So I chose studying engineering in Indian Institute of Technology in India. So you never say never again. What I do now is nothing but chemistry. Chemistry of material. Here you go. As a UCFer, I would say go Knights, but since I'm in the USF campus, I would say go Bulls as well. Thank you.
Okay, our final inductee is Dr. Herbert Worthiam.
I think discovery is who I am. I just like discovering things. I like reading and understanding things. I like to create things that have never been created before. I like to discover great people, great personalities. And my people in my company always say to me, you know, Doc, you just have too many ideas and too many things to do. And I always say, just give me something to change. I don't care what you've done, give me something to change. When people ask me, what kind of an optometrist are you? I always say, I'm a vision neurologist. I deal with the brain and the eye. My field of vision happens to be color vision and tumors and things like that. Our company has designed and implemented probably about 35 or 40 therapeutic lenses to help people in the areas of macular degeneration, grand mal seizures, epilepsy, Parkinson's disease, albinism, retinitis pigmentosa. We have all kinds of lenses that work in a therapeutic way neurologically with the brain. So these are all the things that I've been involved in for the last 50-something years, is the neurology of vision. How does it work, and how can we change it, and how can we make it, better?
Herb Wertheim was really concerned with the overall health of the community and the people in it. Preventive medicine, in his view, was the wave of the future if we were going to have a healthy future.
I think if you ask Dr. Wertheim in particular what his priority would be, he would state very clearly, would be wellness. How do you find ways to keep people out of clinics, out of hospitals, to keep them well? And he knows what it is to live in difficult circumstances. And I know that he wanted to find a way to make sure that others didn't have the same difficult circumstances that he had.
I am a product of public education. Certainly the first person in my family to ever graduate from college. Probably the first person that had a GED, because neither one of my parents ever graduated from high school. So my commitments to public education, whether it be through the Plant Conservatory, whether it be through the Music Conservatory and Performing Arts Center, whether it be through the School of Nursing, Medicine, and now at the University of Florida, which is where I really got my head start.
The Wertheims are all about partnerships. They're all about interaction and infusion of each other with ideas, excitement, and innovative ways of pursuing old problems.
His vision included an intense experience in the community and how we could form a program that was unique, different than any other medical school, with a specific mission to try to prevent illness and to improve the health of communities and families.
Herb's vision for medical education and the role of a medical school in preventive medicine and community health has now been copied all across the country. It's a vital, positive ingredient in the future of medicine.
I'm kind of a farmer at heart, and I'm a scientist, electrical engineer, a physicist, and just plain curious. My goal was to be able to have better health care for our community. I've discovered a great university whether it be the University of Florida, University of Tennessee, FIU, whether it be Stanford or MIT or Harvard. Those are what kind of made me. To me, these universities are my garden. And I plant the seed and I fertilize the best I can. And other people will wind up, in many cases, receiving the crop. But that's my joy.
This recognition is kind of it's the icing on the cake. Thank you for recognizing myself and our company and our hard work for almost 50 years. 50 years of studying the brain, the eye, and the interaction of what it's done for society.
Also, let's hear another round of applause for another outstanding group of innovators to add to the now total 35 inventors who make up the Florida Inventors Hall of Fame. That deserves a major applause. So at this time, I'd like to invite the previous inductees for past years to please join us on stage so that they can also be recognized.